If I had Medicare Advantage insurance, I would be really upset by this news. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 293, and today I want to talk to you guys about the recent news out of Mayo Clinic and how they are no longer in network with certain Medicare Advantage plans. But before I get into this video, guys, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So you may have heard about the news here recently about Mayo Clinic basically saying that they're getting out of network with a lot of these Medicare Advantage plans, including UnitedHealthcare as well as Humana.
A change in insurance coverage for some Mayo Clinic patients may mean even more headache at the doctor's office. Mayo Clinic will soon be out of network for holders of Medicare Advantage plans from UnitedHealthcare and Humana, two of the nation's largest healthcare insurance providers. Mayo Clinic has stated it is already out of network for most Medicare Advantage plans, but does participate in traditional Medicare Parts A, B, and D, and Medicare Supplement plans. The change will affect patients, especially the elderly, who want to receive health care at Mayo Clinic.
Makes sense that this news would come out right around this time because we are in the open enrollment period where individuals can decide if they want to stick with traditional Medicare or switch over to Medicare Advantage or vice versa. Now, if you're unfamiliar with what traditional Medicare is and what Medicare Advantage is, I'm going to break it down for you here really quickly. We deal with this a lot in the hearing care industry, so this is fairly familiar to me. When you turn age 65, the federal government basically takes over your healthcare, at least paying for your healthcare. And so what happens is that you can apply to go onto traditional Medicare. Now, traditional Medicare that's funded and run by the federal government will pay for 80% of whatever approved medical procedures that are out there, okay? And you have to go to an in-network provider with Medicare, and almost everybody is in network with Medicare. Now, they cover 80%. They do not cover 100%. So for the remaining 20%, you can either pay for that out of pocket for whatever that procedure is, or you can get a supplement plan that will supplement traditional insurance so it pays for 100% of whatever the procedure is. Now, there is a very small deductible that you have to pay usually for the whatever first medical visit you have of the year. Couple $100. I think it's even less than $200 unless it's changed here recently. But sometimes even these supplement plans will pay that for you or reimburse it for you. But that is traditional Medicare. You can go to pretty much whoever the heck you want to because almost everybody is in network with traditional Medicare, including myself at my clinic Applied Hearing Solutions here in Phoenix. Or you can end up going the Medicare Advantage route. Now, Medicare Advantage is administered by private insurance companies, all right? For-profit companies. We're not talking the federal government here. And what happens here is that the federal government has allotted a certain amount of money for each individual on Medicare. And so if an individual who's age 65 or above is like, you know what? Maybe I want to go with this Medicare Advantage plan because they include some vision, they include some hearing for like hearing aids, and a couple other things that I do not get with traditional Medicare. And what will happen is the insurance company will say, okay, well, you know, Medicare system, pay us the money that you would have spent on that individual and pay us instead. And now what we'll do is we'll actually administer, we'll arrange different contracts with different providers, and then essentially we will pay out to those providers to cover that individual's health care. And ultimately the goal for this for-profit company is to end up spending less on each insured member so they can turn a profit at the end of the year. Now, it's important to understand that if traditional Medicare covers a certain procedure, the Medicare Advantage plan also has to cover the same procedure. So how do they actually make money if they're basically paying the same for different things? Well, they don't pay the same for these different procedures. Essentially, this Medicare Advantage plan will go to a provider and say, hey, listen, we got a ton of people on our plan. Would you accept 50% of whatever the Medicare payment rate is so we can send these individuals to you? And because you're like one of only a few providers in the area, you're going to get a lot of referrals for us. So instead of us paying you the traditional going rate for whatever the procedure is, we're going to pay you less, but we're also going to send you more people, so that should make up the difference. That in a nutshell is how Medicare works and how Medicare Advantage works. And I'm sure that there's going to be people out there who are like, oh, it's a little more nuanced than that. And maybe it is a little bit more nuanced than that, but in general, that's how it works. Now, every single year, different providers and different individuals who want to be on these insurances will make a determination who they want to be in and out of network with. So this open enrollment period is essentially for a couple of months. I want to say it's like mid-October to mid-December. And so anyone who's age 65 and older can either switch from traditional Medicare to Medicare Advantage or from Medicare Advantage back over to traditional Medicare. But different hospital systems and different providers and clinics will make the decision of, does it make sense for me to actually stay in network with these Medicare Advantage plans? And ultimately, does it make sense for me to stay in network with traditional Medicare? Because there are some providers out there who've gone completely concierge. They do not accept any type of insurance, whether it's Medicare Advantage, whether it's private insurance, whether it's Medicare. But what Mayo Clinic has decided to do here is to stay in network with traditional Medicare and get out of network with Medicare Advantage plans. Now, I don't think that they're out of network with all Medicare Advantage plans, but I think that they're out of network with like a lot of the major ones. Now, if you read through all the news reports on this, you will not find that Mayo makes a statement of exactly why they got out of network with these Medicare Advantage plans, but I can pretty well assume that the reason that they got out is because the reimbursement rates were starting to become ridiculously low, to the point where they were either going to have to take a loss on every single Medicare Advantage patient that they saw, or they were going to have to cheapen the quality of care that they gave to these patients. And in my estimation, Mayo Clinic probably determined that it didn't make sense to do either one of those. So at the end of the day, even if you don't have any serious medical conditions right now, if you're on Medicare Advantage and it turns out that you actually need to go to Mayo because you have some type of rare condition, or you just want the best of the best to work with you with whatever health condition that you have, you're not going to be able to go to an in-network provider at Mayo Clinic, and you're going to have to pay a significant amount of money out of pocket. Now, considering that this is a hearing channel, let me explain how these Medicare Advantage plans affect hearing care. Now, just to give you a little bit of a background here, I used to be in network with a lot of these different Medicare Advantage plans because those Medicare Advantage plans would contract with a third-party network. These third-party networks are like UnitedHealthcare Hearing, you have Epic, you have True Hearing, you have Amplifone, and there's a variety of other private companies that will administer these healthcare benefits of these Medicare Advantage plans. Now, the reason I used to be in network with these third-party networks is because they actually reimbursed a decent enough amount of money for me to justify seeing the patients that they would send over. And oftentimes they wouldn't really even send patients over, but a patient would call, want to schedule a consultation. We would run an insurance verification check. We would identify, oh, hey, you happen to have the type of insurance that has some level of a hearing aid discount, so just wanted to let you know that, so when you come in and you get treated by us, we're going to be able to utilize that discount for you. But as time went on, and remember, I started my clinic back in 2017, as the years went on, the amount of reimbursement that we got from these third-party networks that were contracting with these Medicare Advantage plans got lower and lower and lower and lower, to the point where we literally lost money on every single patient that we saw. Now, for the patient, they probably thought, hey, this is great. I'm getting a discount on my hearing aids. I go in to see a hearing care professional who's going to be following comprehensive best practices with me. It is a win-win situation. Until we decided that we, just like Mayo, had to get out of these third-party networks because there was no way for us to administer the quality of care that we needed to administer to make sure all of our patients heard their absolute best. It was either that or we take a loss on every single Medicare Advantage plan patient that came into our clinic, and we did not see that as being fair for the other private pay patients that we had that would basically be subsidizing their care. And here's the thing, over the course of the past 6 years or so, since we started eliminating these contracts with these Medicare Advantage plans, a lot of other providers had started to do the same thing inside of the hearing care space. So now it is extremely difficult to find an excellent hearing care professional who is in network with the third-party network that is administering the hearing care benefits of these Medicare Advantage plans. So if you have Medicare Advantage, you might get a discount on your hearing aids, and that's fantastic. But then when you go and you get treated with those hearing aids, you're like, I'm not actually hearing that well. And the reason why is because those providers just do not get paid enough from the Medicare Advantage plans to justify them spending any amount of time with you or providing you with any level of quality of care. And as time goes on here with these Medicare Advantage plans, more and more hospitals are going to leave these networks, and a lot more audiologists and other hearing care professionals are going to be leaving these networks. So if you have Medicare Advantage, you have to strongly consider whether or not it is worth it to stay in network with your Medicare Advantage plan, or whether it makes more sense to go over to traditional Medicare. But I want to know what you think. What do you think about this news about Mayo Clinic finally deciding to go out of network with a lot of these Medicare Advantage plans? And what do you think about a lot of hearing care professionals ditching these third-party networks that are administering the hearing care side of things for these Medicare Advantage plans as well? Let me know down in the comment section, and I'll see you in the next video.